This clip is sponsored by Med Travelers. If you're an SLP interested in travel therapy, visit medtravelers.com to get started. So tell us about what's a day in the life, I think, of just, what you're doing at the hospital. And
Yeah.
you also have a private practice as well. So what would a day in the life in the hospital look like for you?
Yeah. So the hospital, I work kind of in a large outpatient ENT clinic. So all of my direct colleagues are physicians, and then there are two speech pathologists, three audiologists, and a PA that work in the practice. What's really nice about the practice setup is that we're all technically independent providers. So my schedule is my schedule. I'm not part of a rehab department, which is really unique in terms of contracting and pay, that I think we could probably end up talking about more in our field, just how the contracts work and what that looks like. So I have a lot of autonomy in the position that I have, which is really nice. And it allows me to kind of tailor the work that I do, even on a day-to-day basis. So any day can be anything, as in there are some days where I have 10 new patients in a row. There are some days where I have 7 therapy patients in a row. There are some days where I have 6 teletherapy patients and then 2 new patients in person. And so it tends to be really flexible just based on what the practice needs. In our practice, all the new patients see a speech pathologist and a physician at the same time. So we have kind of a collaborative approach in terms of clinic, which is pretty standard for voice centers around the country, but not necessarily standard for how all speech pathologists work. And so that's a kind of a unique thing. Um, Grateful I don't, just like how our job works, I don't have um, productivity standards at all, which allow me to focus on other things that help build the practice. So I present a lot at conferences and we work a lot on research. And so as long as we're kind of contributing, it counts. And so I feel like I'm in the sweet spot in terms of academic medicine and also kind of being a little more independent. It's really cool.
I mean, sounds like a dream job. I mean, you're saying it thinking, what? You have no
Yeah,
productivity standards. You have this
yeah,
autonomy. It's
yeah,
this collaborative approach.
yeah.
I mean, you kind of hit the jackpot with this one. Sounds like a great,
Remember, I said I thought I was a great job fit for this job too.
yeah, I know. So they hit the jackpot with you and it's like,
Yes.
mutual, but
Yeah,
wow, that's, yeah. And I think you're exactly right. Maybe that's what when you're going to come back to another podcast and we're going to do karaoke and talk about contracts
I
and
love
pay,
it.
because you're
I
right.
love
That
it.
is another whole arena that I think, well, I don't think, I know that a lot of us really don't have that knowledge about. It's not
Yeah,
something we're taught or part of our schooling. So,
yeah.
so I like that you bring that up. Um, and so every single patient that you're working with is somebody who's already been identified or is suspected of having some sort of voice disorder or problem.
Correct, correct. And what's interesting, we think about speech pathology as a lot of therapy, and my job is a lot of therapy. I'd say maybe 50% of my time is spent in one-on-one, like behavioral voice therapy. But I'd say 50% is spent in diagnostics. So we do a lot of new patient evals where we're just trying to figure out what's going on. And then being in the city of Houston, I mean, it's a city of millions of people, and there are only two speech pathologists at our practice. So we do a lot of referring out to other therapists. So I evaluate more patients than I see. We try
Mm.
and keep in-house the things that are a bit more challenging or the things where like that I care about. So I keep a lot of the singers that I evaluate just because it's easier for me to work with them than maybe a speech pathologist who's never had music training. So it kind of comes down to like what's most practical. And then even within that 50% of doing therapy, a lot of it is education. We do a lot of pre
Mhm.
and post surgical education. You think about the head and neck cancer population, they're doing a lot of education and a lot of testing before and after. It would be similar in terms of what we do in our practice. I work with two surgeons. So a lot of the work that we do is pre and post surgery or some sort of procedure on the vocal folds.